Response to a fall for someone living in a care home. The vision for the future of care in Wales is for everyone to have more effective, person-centred, community-based care provided by health, social care, housing and public and private sector partners working together. At Healthcare Inspector at Wales, we are responsible for checking that people receive good quality healthcare. We have undertaken a national review of integrated care with a focus on falls, which assesses how systems work together and makes recommendations for how they could work together better. Response to a fall for someone living in a care home. This is Geetha. She is an older person who has fallen in her care home. If the services that are in place to care for and support Geetha don't work together in a joined-up way, she may experience an unnecessary wait for an emergency ambulance, an avoidable admission to hospital and missed opportunities to solve the root cause of her preventable falls. In a joined-up system, Geetha can expect a thorough and safe post-fall assessment from the care staff who know and look after her. Person-centred care provided at home wherever possible, taking into account what matters to her and meaningful assessment and intervention to aim to prevent harm from falls in the future. To improve the care and support Geetha receives, we recommend falls in people aged over 65 should be a priority in its own right. Increase public engagement around significance and preventability of falls. Value the social care workforce. Fund preventative resources. Standardise a national framework. Deliver clear local models of joined-up care. Everyone who works in the system should aim to deliver person-centred care. Develop a sufficiently trained workforce to meet the needs of the population. For more information and to read the report, go to www.hiw.org.uk/falls review.